AI is really going to be the game changer in aortic procedures. First, when we analyze a CT scan from the patient and when we need to compare one CT scan to another, AI will help us to be very accurate, not only looking at the maximum diameters at various segments of the aorta, but also at comparing volume. And this is something that is so time consuming if you do it manually that you actually don't do it routinely. So in the future, it's going to be automatic, and so we can select the appropriate patients for treatment. Those that really need a treatment will be accurately selected thanks to AI. Now the next step is when we have decided to treat a patient, is AI will help us to automatically design the endograft. And not only complex, sexy fenestrated endograft, all endografts will be designed through this AI platform. What is really nice is you will have various options, and you can actually test, you can simulate the implantation of those various endograft design within the patient's aortic anatomy. And then we will be able to select the most appropriate graft design for a specific patient. Now, this is prior to performing the procedure. Now, during the procedure, AI will be very useful because it will fine-tune the fusion mask throughout the procedure. So you will not need to inject contrast and do various rounds to check that your fusion mask is really nicely positioned. It will automatically perform that fine-tuning, so you'll be faster, you'll be more accurate, and obviously you will expose the patient to lesser radiation dose and lesser contrast volume. And obviously, the long-term benefit will be obvious because the best graft design to fit to the perfect patient anatomy and the perfect procedure, so a major impact on patient outcomes. So we've started working on AI a couple of years ago, specifically with the French startup company, Young Bright Engineers. We've worked with Inceptor Medical, and together with them we have designed a specific software that automatically analyzes CT scans, and this is already CE mark and on the market. Now, we've also worked with Predisurge. It's a startup company from Saint-Etienne, and with Predisurge we have worked on automatic sizing tools, and so this company is currently capable of providing a software that will automatically design a fenestrated endograft and obviously a standard endograft. Now, also with Predisurge, but combined with GE Healthcare, we have been working on how a fusion mask can change, or let me say it another way, how the anatomy changes throughout the procedure and how you need to change your fusion mask. And AI will be a real, again, game changer in that field and will help us during the procedure. Those are the future steps to be developed. This is not ready, but we are working on it, and it's really flying, and I hope that it will be soon available for everyday practice.